Now it's very important to differentiate between a convergence insufficiency and an accommodative insufficiency. Sometimes convergence insufficiency might be associated with an accommodative insufficiency. Normally what happens, if our convergence is poor, our accommodation balances it, right? Our accommodation comes into play and try to balance it, right? But sometimes what happens, a patient's convergence can be poor, along with it accommodation also can be poor. Okay, now how to differentiate all these things, how to diagnose all these things, like whether is it a convergence insufficiency or a accommodative insufficiency. For convergence insufficiency especially, you will see that the convergence is very poor. Okay, so when you measure the near point of convergence of the patient will have difficulty to do any task with the both eyes open, right? That means the convergence is poor, the positive functional convergence becomes poor. So that is the thing in case of convergence insufficiency. So the convergence is very poor, right, in case of convergence insufficiency. But in accommodative insufficiency cases, what is happening? The accommodation is poor. That means the patient feels difficulty to focus with one eye. Okay, but the binocular, so once you check the accommodative facility, basically you can differentiate here. Why? Because you are checking the accommodative facility with the help of flippers, right? So when you are doing the flippers test, right, you will find that the monocular MAF is poor compared to the BAF, means the monocular accommodative facility is poor for the patient. That means when you are checking the flippers closing one eye, the patient is finding it difficult to clear the cycles, right? The cycles per minute, it is lesser. But when the both eyes are open, the patient is finding it better to clear it. Okay, that means the accommodation is poor. Okay, the convergence will be better in this case, right? So these things you need to keep in mind. Accommodative like the components will be lesser, your MEM value you will find a more lag of accommodation. In case of when you are doing the monocular estimation method, MEM value, you will get a more lag. Okay, you will see the monocular accommodative facility findings to be lesser compared to the binocular accommodative facility findings. Okay, the patient will have difficulty to change focus for distance and near. The patient might have difficulty to clear it. Okay, so these are some signs. When you are checking the near point of accommodation, it will be lower. Okay, so basically how you differentiate while checking the accommodative facility. Okay, so this is how you will differentiate between an accommodative problem and a convergence problem. In convergence problem, the binocular findings will be lower. A patient's convergence facility will be low. Okay, the patient's convergence facility will be low. You can check the convergence facility with the convergence flippers. You can check the NFB PFV with the horizontal prisms, base in and base out prisms. You will check it. So those things will be low in case of convergence problem, right? So some parameters, you see those parameters basically to check. First you do a complete orthoptic evaluation of the patient. Now compare the parameters, the convergence parameters, then the accommodative parameters. Now you should, if you have any doubt, you should do a repeat. You should do it repeatedly and find it out how the patient is behaving. Okay, so when you compare those parameters, if you're seeing those accommodative parameters are lacking, okay, then it will be an accommodative insufficiency. If you're seeing those binocularly, the patient is facing difficulty and the patient is having a low NFB PFV value basically, the positive functional value is very lesser. So that means it is a Convergence problem. So these things, you basically, these concepts needs to be very clear when you are differentiating an accommodative insufficiency or a convergence insufficiency. Sometimes in a case of pseudo convergence insufficiency, what you are finding, you once your the symptoms of the patients are very similar to convergence insufficiency, but when you are doing an orthotic evaluation properly, you will find that the convergence, yes, the NPC might be receded. In case of pseudo convergence insufficiency, NPC will be receded. But once you are comparing and checking the accommodative and convergence parameters, you will find that the accommodative parameters are not good. Okay, the accommodation is somehow it is less. Okay, so pseudo convergence insufficiency means it's a basically an accommodative insufficiency, but it seems like a convergence, a false convergence insufficiency. So these things you need to keep in mind while differentiating an accommodative insufficiency and a convergence insufficiency patient. Thank you.